on COVID-19 in Simcoe, Muskoka. So when I last spoke on May the 1st, excuse me, I do hear an echo. Does somebody have their line unmuted? Just checking in. Okay. When I last reported on May the 1st, I reported that we had 283 reported cases. As of 9 o'clock this morning, we have 318 cases, so that's 36 new cases. 15 of these are in long-term care facility outbreaks. 10 of these are at the Owen Hill facility. 2 are from the Whispering Pine Retirement Home, which is a new outbreak declared on May the 1st. 1 is at the Bradford Valley facility. 1 is with the Allendale Station Retirement Home, which is a new outbreak declared on May the 1st. And 1 is with the Bayview Retirement Home. That leaves another 21 community cases. 1 of these is hospitalized and the rest are recovering in self-isolation in their home. The person who's hospitalized is a woman in her 70s from Barrie, who's at RBH. If you look at the others, they range from the teens to the 80s. 10 of these were acquired in the community, 8 were close contacts of a case, and 3 are under investigation. And all of them occurred in Simcoe County. None of them were in Muskoka. We have at this time 8 that are hospitalized, 2 are in the intensive care unit. We've had no additional deaths, I'm happy to say. Looking at our outbreaks in long-term care facilities, we have now a total of 7 in long-term care facilities or retirement homes. They are as follows: Bradford Valley, IOOF, Woods Park Care Center, Owen Hill Care Community, Bayview Retirement Home, Whispering Pines Retirement Home, and Allendale Station Retirement Home. And we have 1 in a group home as well in Bradford, West Gwillimbury, as previously reported. If you look at Bradford Valley, to date they have 42 laboratory confirmed cases. 11 of these are staff and 35 of them are residents. Of these, 9 have deceased, 1 is hospitalized, and 1 has recovered. IOF continues with only 1 positive staff member and no residents. Woods Park has 2 positive staff, and 1 of these has recovered and 1 resides out of area, so is not in our line listing. Owen Hill Care Community has 22 positive cases. 8 of these are staff, 14 are residents. Bayview Retirement Home has 1 positive staff, which is unchanged from my last report, and 1 positive resident, which is new. And Whispering Pine has 1 positive staff member and 1 positive resident. Allendale Station is one of our new outbreaks with 1 positive resident and no positive staff members. If you turn to our posted information on our health stats page, you'll see that the largest grouping of people with COVID-19 are those in their middle years, 35 to 64. The next largest group, those 65 and above. 166 have now recovered. 82 are in self-isolation, 41 are in isolation and long-term care facilities, 8 are hospitalized, a total of 20 are deceased, so no increase. And if you look at where people acquired their infection, the largest grouping is community acquired at 107, 76 from close contact, and then 52 are related to outbreaks, 22 are undetermined, and by undetermined we mean staff members who work in facilities in outbreaks. It's possible that they got it from the outbreak, or it's possible that they got it otherwise, such as community acquired. And then 54 are travel related. So we still have community transmission that's happening. We still have a significant number of new cases occurring both in long-term care facilities and in the community. We do have 2 fronts that we're managing right now, so people need to be aware that there's still community transmission happening. There's still asymptomatic cases that can lead to transmission to others, so you need to practice your physical distancing, 2 meters setback from other people, avoiding crowds, frequent hand washing. If you develop any symptoms, you know you need to go into self-isolation, and then seek assessment and testing, contacting an assessment center. Certainly, I encourage people to get tested. It's better, much better if you know your status. We can follow up with you. We do follow up with all laboratory confirmed cases for assessment, for support to be into self-isolation, for follow up with the contacts of those individuals to put them into self-isolation to help flatten the curve and prevent further transmission. When we look at our epidemiological curve, we see it flattened. We don't see it elevating, but we see it continuing. It's certainly not over yet. I would say that if we're declining, it's at the beginning of that. We're not really well into declining. And we're still having very much cases and outbreaks happening in long-term care facilities. This is an area of great concern for us, a large part of our work. We've so far done a total of 1,200 tests in our long-term care facilities that are in outbreak, and a further 397 tests for facilities that are not in outbreak as part of our surveillance of all the long-term care facilities, and in order to support the province's direction that we're to do that kind of testing to identify possible asymptomatic cases, early identification of outbreaks, and further protection for people living in long-term care facilities. Just going to go through some of the matters that have come up recently. The Chief Medical Officer of Health has reiterated the importance of people staying at their primary residence and not going to secondary residences, such as cottages. This is particularly pertinent to us in Simcoe, Muskoka, because we are prime cottage country. We receive more secondary residences, cottagers, campers, summer camps, people come here from southern Ontario because it's a beautiful area and it's accessible, and normally that's a very good thing. But this is a pandemic year, a very different year, and we are concerned that having a large influx of people from out of jurisdiction could increase transmission in our district, and so we're asking that people not go to your cottages at this time. There will come a time in which that would be okay, but it is not a good thing to be doing now. We're also concerned about the potential to strain the healthcare system. Right now it's functioning well, but if we have a large influx of people, that could change. And there's also potential for people not to get access to optimal care if they're in remote areas when they emerge as a case. So the Chief MOH has reiterated that, and I certainly support that message as well. Mother's Day is coming up. As I was saying, it's important for people to exercise physical distancing to avoid transmitting this infection to other people, particularly vulnerable people. And so older people are more vulnerable to the effects of this virus and more likely to become seriously ill, need to be hospitalized, need to be treated in the intensive care unit or ventilated, and they're more likely to, significantly more likely to die from this. So I would recommend that when you reach out to your mother on Mother's Day, that you do it in a distance fashion. You can do it through distance technology. If you do actually go by the property, that you must maintain that distance. There's got to be that distance because you don't want to transmit this to your mother, your father, other older people in your family, or to anyone else for that matter. We've had questions about COVID in children. Dr. Theresa Tam, the Chief Public Health Officer for Canada, had noted some research in Australia that demonstrated that children tend not to be super spreaders of COVID-19. Now, a super spreader is a person who is highly infectious and contact with many people who then transmits to many people. This has been documented to be the case in some instances for COVID-19, as it had in the past with SARS. It can be the case with influenza. And so the concern early on was that there would be potential for children to transmit this virus to other people in the family, to act as a means of augmenting the outbreak, the pandemic. And that was one of the reasons why schools were closed and why daycares were closed, to break that chain of transmission, to be a precaution against this possibility. So research is now coming out to show that although children indeed can transmit this virus, and they might do so without symptoms because they tend to be less impacted by the virus than adults, in fact, they aren't transmitting to the same degree as they would be with influenza, and therefore there may be less of a concern about this phenomenon of them being transmitters to other people. So we shall see what that means when it comes to the province's direction about schools and about daycare. The potential, certainly at some point, they will be opening schools again. We'll see exactly what steps they take with regards to that, how they do that. There will undoubtedly have to be physical distancing measures put in place when they do so. But this is an important, I think, finding for us that would help inform that decision about when and how to open up schools and daycare. There has been a case of a cluster of COVID-19 in a child care center in Yorkville, in Toronto, the GTA, and this involved care providers and a child, and the province has now directed us as health units in response to this to test the workers in all child care centers. So we are going to proceed with that over a 2-week period. They've given us 2 weeks to do that, as well as 2 weeks to test all the residents and all the staff of long-term care facilities. We'll be extremely busy with that. It's worth noting that the total number of swabs we will be taking for the long-term care facilities is 7,800 in total. And then on top of that would be the long-term care facilities. I'm sorry, the daycare centers for children. So that's going to be a very big job. Certainly, in all of that, we need to work in partnership with hospitals, with the community and home care providers, with paramedicine, with assessment centers in order to come together to do that very big task. We will hunker down and carry it out to the very best of our ability. There's been some concern raised about pregnancy and breastfeeding at this time by some people in the media, people that we're in touch with. So I would say that we continue with some of our services here at the health unit. We have to prioritize what we do, given that we put so much into the COVID response, but we have kept up some capacity for healthy growth and development, offering prenatal classes through our website, And we also provide telephone assessment and support for breastfeeding families through our Health Connection line. So people feel free to call us at our Health Connection line or through our infant feeding pilot program in South Simcoe. We also provide appointments 2 days a week via the Barrie and Community Family Health Team Breastfeeding Clinic. And our Healthy Babies, Healthy Children program continues to provide telephone support for families enrolled in this program throughout Simcoe, Muskoka. So please come to our website or contact us via Health Connection for these services. This is Mental Health Week. I have often reflected on how hard the present circumstance is on us all, how hard it is on our mental well-being. I think it's hard on our physical well-being, impedes social interaction and impedes physical activity, which we know is important for health and for mental health, impedes ability to get out and enjoy green space, other things that are good for us. So for one, I would suggest, if you are so interested, please come to our website. We have support for you section on our website. They'll have some information about coping with regards to mental well-being. And self-care, and basically some reflections on how to be kind to yourself and be kind to others as part of being good for you and your mental health. I know that there have been strong messages from the province that people should only go out to shop for others, to go to work, to walk the dog. I have always added that it's important to get physical activity. And although when you go out to be physically active, you need to do so in a very careful way, and you need to maintain physical distancing, I always feel that this is an important thing to do, and it is important for mental health as well. I think that you need to be more cautious if you're older, above the age of 70. The chief MOH had advised that so people who are older should be in physical isolation, self-isolation at this time. But we do foresee a point where there may be the potential to relax these measures. Definitely coming down the pipes, there will be a point where we'll be able to do so. We're seeing the province moving on certain businesses now. We do know that certain countries, such as New Zealand, have this concept of the social bubble. Right now in Ontario, that is only your household. I have positioned before that people who live completely alone may very well benefit from identifying another individual or household in which they have a mutual relationship of being essentially together as needed, because otherwise people who are completely alone would be profoundly isolated. But I anticipate down the road at some point in the not distant future there'll be this idea of potentially increasing your social bubble to maybe one other household, one other family member. We shall see when that comes. I hope it comes soon. So some other things that have come up, questions from Facebook, from the media. How many long-term care facility residents and staff will be tested over the next 2 weeks? And as I said, a total of 7,800 residents and staff combined will be tested. Why are so many COVID-19 tests coming back negative in our region for long-term care testing? We are being proactive in our testing. We are testing people who don't have symptoms, certainly testing those who do, but also testing everybody else in the facility who don't. And the great majority of people who don't have symptoms don't have COVID-19. So therefore, we're seeing those negative tests come back. I think that's a very positive sign. I would rather be erring on the side of caution and testing people who come back negative than missing people, not testing people who would have come back positive. So to me, it is a good thing, a good sign that we're getting a lot of negative tests coming back. How long can you be spreading the virus once you're symptomatic? So Research has shown it's in the range of 8 days. 14 days is precautionary, and that's what we require for people for their isolation. We can, after 14 days, get people that continue to have detectable virus, but the research that's been done on this has demonstrated that the levels of viral shedding at that point are very low, if they exist at all, and there isn't demonstrated transmission of infection at that point. So a safe bet would be 14 days with symptoms having cleared. You need your symptoms cleared as well. People sometimes can have a lingering chronic cough after, but have all their other symptoms cleared, and that's okay. But otherwise, you'd need your symptoms cleared, and it needs to be 14 days. We also used to say that healthcare workers needed to be tested to be, after 14 days, to be doubly sure. There's now provision for that not to be required. As restrictions are being lifted, why are we not pushing that everyone should wear a mask when they leave their house? So masks are important for healthcare workers working with patients, whether acute care or long-term care, and we are recommending that they wear them universally. The type of mask that they wear would depend on the kind of care they give. We should be saving surgical masks, N95 masks, and procedure masks for that use in healthcare because of limited access to those masks. The Chief Public Health Officer of Canada, Teresa Tam, has suggested that otherwise in the community, for people who are in a situation where they are challenged in being able to maintain physical distancing of 2 meters, that they might consider wearing a homemade cloth mask, and that would be to reduce the likelihood of transmission from the wearer to other people. There isn't evidence of benefit going the other way around, but if you wear a mask, you potentially could be an asymptomatic but COVID-positive individual who could transmit to others. You wear the mask. In that situation, you reduce transmission to other people. We would emphasize it's far more important that you observe the physical distancing of the 2 meters, and that you hand wash frequently, and that if you develop symptoms, you put yourself into self-isolation and seek assessment. If you are wearing a mask, you need to be careful about putting it on and taking it off, avoiding contaminating your hands and then touching your face, because then you could potentially auto-infect yourself or contaminate surfaces that could then infect other people. So anyway, that would be the position that we have at this time, and as we learn more, we will keep people informed of what we learned, or if there's any changes in recommendations. It's been reported that Newfoundland is now telling people they can expand their bubble to include another family member of individual, and when is this going to happen in Ontario? So I have reflected a bit on this. We haven't had official word to do this yet. I am hopeful that we will get there in the not too distant future. I think this is one of those things that could have a great benefit for people's quality of life. It would have, of course, when done, to be done carefully. The arrangement you'd have to have would be with a person, or depending on what is recommended in the end, how big that group would be, but it'd have to be a mutually exclusive relationship, not then allowing others into the bubble. What assessment testing has been done and where in Simcoe, Muskoka? So we have, of course, we have our assessment centers that are continuing to do their testing over time. If people have specific questions about exactly how much in the way of testing has been done, I'd be happy to run through that. Do you have any updated numbers on people that tested positive in Simcoe, Muskoka, but then returned to other health units? Do you know how many were tested in Simcoe and how many Muskoka, and what is the rate of testing in Simcoe County versus Muskoka? We have a higher rate of testing in Simcoe versus Muskoka. I'll get into that data with specific figures in a moment, but first I would like to say that we have limited data on testing, that the amount of testing that happens in Simcoe, Muskoka is Not all of it comes to us because we get the data from the assessment centers, but we're aware that testing can also happen in hospital and emergency departments. And so also we're doing testing in long-term care facilities with their outbreaks. So although we get the data from the long-term care facilities and from the assessment centers, we're not necessarily getting it from the hospitals. We don't have a complete picture on how much testing is actually happening here. And we don't have a breakdown on the question of people being tested out of area, or people being tested in our area but then going out of area. We had a figure of 33 that I'd given before, but I wasn't able to break it down between Simcoe versus Muskoka. We've got some rates here, totals and rates for tests. So the total amount of tests that we're aware of from the assessment centers that's been done in Simcoe, Muskoka to date is 9,242 tests. So in Simcoe County, it's 8,684 tests, and in Muskoka, 558. And if you convert that into a rate of tests per 10,000 population, the figure for Simcoe County is 167 tests per 10,000 population, and for Muskoka, it's 85.8 tests per 10,000 population. So quite a bit more testing on a per capita basis in total has been done in Simcoe County versus Muskoka. And then if you look at more recent data, the question, has this been changing or improving or narrowing? I'm afraid it has not. The tests over the last 2 weeks per 10,000 population in Simcoe County is 86, so 86 tests per 10,000 population. In Muskoka, it's 45.7 tests per 10,000 population. So there's more testing happening on a per capita basis in Simcoe County than in Muskoka overall and in the last 2 weeks. So at this point, I would be happy to take questions.
Okay, thank you. I think there's still someone on the line who may have their phone not muted, so if you could just check, that would be great. And in the meantime, let's start with Mandy Webster from Rogers. Do you have questions?
I'm just looking for more information, Dr. Gardner. You talked a little bit about children and how they're not super spreaders, and a little bit about how we're going to take that into account when it comes to opening up schools and things like that. Do you have an idea, in your personal opinion, about when schools may be safe to reopen?
It's a key question. I think that this research makes it more likely to happen sooner. I still don't have a clear impression as to when it should happen. I think that there may be other opportunities to make our lives more pleasant, more things that could be relaxed in the interim before you get to schools. For me, I'm quite enamored with the idea of extending the social bubble as one of the things that we could do. There'd be certain services and work environments that might be easier to do. There'd be certain community locations that were prohibited from using now that they might want to relax, such as locations in parks and in provincial parks. So I think we have other opportunities to improve the quality of lives as first steps before we get to schools.
Great, thank you. Appreciate it.
Thank you, Mandy. Do we have anything from Ian McLennan from Barrie 360?
Hi there. I'm just wondering, Dr. Gardner, you reiterated again that you've been on messaging about this regarding cottagers not to come to their seasonal properties. So Premier Ford at his media briefing today, when asked a similar question, said there's only so long you can hold back taxpayers, and into that possible good news for cottage owners ahead of Victoria Day. So if I'm a cottager, what you're telling me what Premier Ford might be hinting at might be two different things. How do you read it?
Well, I think he's stating a fact as he sees it, which is that there's a strong desire for people to go and access their properties, and he needs to make decisions made based on many things. The advice I give is based on health. I'm focusing on my mandate and my concern that there would be the potential for increased transmission. At the end of the day, I need to make my statements and provide my advice based on that.
I wonder, Dr. Gardner, I would just follow up one question. The the medical officer of health of Halterman, Norfolk, the Lake Erie area, issued a directive for cottagers not to go to their seasonal properties, so they're banned. What's your reaction to that? Would you take even that step, or was that too broad?
So the medical officer of health in Halterman, Norfolk issued an order under the Health Protection and Promotion Act prohibiting people from accessing their secondary residence in that jurisdiction where he has authority. I became aware of it, and we did a review on that here. We consulted quite broadly about that with other colleagues of mine, legal counsel as well, local politicians, looked at our data. We came to the conclusion, or I came to the conclusion, that although there would be potential merit on a health basis, it would require us, if I were to issue that order, it would require us as a health unit alone to enforce it. We do not have nearly the resources required to enforce an order like that with the tens of thousands of people who have properties in our jurisdiction. And so I decided that we were not going to try. We instead have been providing messaging to the public and advice to the province.
Okay, thank you very much.
You're welcome.
Thank you, Ian. And do we have anything from Doug Cross?
Just on the back of the Alderman Norfolk comments, Doctor, is there no mechanisms or ways to get local police enforcement to help you on something like that? If that was an order you wanted to issue, or does the Act just state you're completely on your own for getting that done?
So, unfortunately, the Health Protection and Promotion Act is entirely enforced by local public health, employees of local public health, and not by other enforcement personnel such as police or bylaw officers. So if I used that act, which is the act that I have to use and that alone, then we would have to enforce that on our own, and we don't have the ability to do it.
Do you find that a bit of a loophole, and not against you or what you're trying to do, but doesn't the government kind of leave you in a lurch having to satisfy the commitments to that act?
Well, I would say that normally the act is not meant to be applied to something of this magnitude. It's usually meant to apply to a very specific local issue involving a very limited number of people, in which case we would definitely have the resources to manage it ourselves. On top of that, this is an extraordinary circumstance where all of our resources are pretty well tied up in responding to COVID and the case and contact management and the telephone public provision information aspects of COVID, and it leaves us really with very little left in the way of resources, certainly not enough to take on something of this magnitude.
I appreciate that. I'm not trying to be going over my limit. I just wanted to confirm that 7,200 number, does that include 1,200 tests already done? Is that the fulsome number of testing to be done?
It's my understanding. I actually need to clarify that. We'll get back to you about that. I think you're asking about that versus the number that have already been done, right?
Correct, yes.
Yeah. Let me clarify that. We'll get back to you on it.
All right, thank you for your time today.
Okay.
Thanks, Doug. Dana Goldfinger, do you have a question for Dr. Gardner?
Yes, I do. My question is concerning the most recent outbreak that was announced at Allendale Station. So given the fact that one resident tested positive for the coronavirus, do we know how the virus made its way into the facility, and are staff
So we are indeed testing everybody at all of the outbreak, all the facilities that are in outbreak. We are testing them all. We're making it a priority now. And at this point in time, we don't know exactly how the virus came into the facility.
Thank you. And then my second question is, at this point, during the first COVID-19 wave, do you think that most of the new cases we're going to see in Simcoe, Muskoka going forward are going to be among people in long-term care and retirement homes, or do you think these are also going to be community acquired mostly?
So the pattern in the province and federally is that although the outbreaks in long-term care was something that's happened later in this outbreak, not at the very beginning of the outbreak. So it began with travelers and then became transmitted in the community with community-acquired and close contacts of cases. And then relatively late on, when we've had a large cohort of people that are in the community with this virus, it's found its way into these facilities. So it's been the latter part of the outbreak that we've had these cases, but they've made up more than half the deaths, unfortunately, tragically. And the reason for that is that these are very vulnerable people in a very vulnerable environment, and they're much more likely to die from it when they get it. So about a quarter of our cases to date have been associated with outbreaks, either the residents or the staff, and about half of, I'd have to actually tally it up, about half of our deaths as well have been associated with these long-term care facility outbreaks. Have I answered your question?
Thank you, Dr. Gardner.
Okay.
Thank you, Dana. Dawn Huddlestone, do you have a question for Dr. Gardner?
I do, please. A quick clarification. You said that you still aren't receiving all test results from all places where tests are being conducted, but the health unit does still receive all positive cases. Is that correct?
Absolutely, by law, under the Health Protection and Promotion Act.
Okay, and do you have any indication why the rate of testing per capita is still so low in Muskoka?
Well, I know that they have assessment centers. I actually don't have a good handle on why that would be. It may be that they actually have a lower incidence and transmission in their community. It's that much farther north, there's definitely a gradient when I look at the map of the province about the per capita incidence of this disease. It's higher the farther south you go towards the urban centers like Toronto and the GTA. It's part of the reason why I'm concerned about cottagers, for example, because of the higher incidence of infection in the GTA. And so Simcoe Muskoka has got about 1/3 the per capita incidence of COVID-19 versus the GTA municipalities. And my impression when I look at Muskoka is it may be that it's got that much lower an incidence versus Simcoe, though I cannot know that for sure. So that might be part of the answer. But I do know that they are providing access to actual testing, so I don't think it's a matter of people not being able to get it done.
Great, thank you.
Thank you, Dawn. Erica Engel, do you have a question for Dr. Gardner?
Yes, hello. My question goes back to the mental health issue, and specifically for residents of long-term care homes right now. I understand in a lot of cases, and maybe you can confirm whether this is like in general or just an outbreak, they're confined to their rooms for meals. There's no routine activities and things that they're used to, and it's been even longer term than some people in their homes. So is there something that the health unit is doing for their mental health, and what is it like for those residents right now who are confined to their rooms pretty much all day?
Yeah, there's no doubt in my mind that is very hard on the people in that situation. for many reasons. It would be hard in any of us to be confined to a room without direct contact with loved ones, and all the more so if we're frightened because there's an outbreak happening, and all the more so if we're a case and we're affected by it, and then all the more so if for those who have dementia, they would be that much more challenged to understand what's happening. It'd be that much harder on them. I have no doubt this is very hard on them. I don't have a good answer, actually, apart from using distance communication or visits through the window. I don't have a good answer for it. It would come down to doing what we can to allow them what as much social contact would be permitted under those circumstances, whether or not they're an outbreak, and to provide loving care, right, for those that are providing the care. And I think that the people that are providing the care are called upon to do heroic work under very difficult circumstances, particularly if there's an outbreak happening. But I would think even now, for those that aren't in an outbreak, it would still be highly stressful because of the restrictions that are in place, because they have to wear the personal protective equipment, and because of the potential for an outbreak. So I don't have a good answer, I'm afraid.
Is there anything you think family members or even just people in general who are concerned can do? I know there's some like letter writing programs, things like that.
Well, I noticed in the Star today an interesting idea of a facility that set up essentially a visitation room at the entrance of the facility that was encased in plexiglass, so that people could more readily visit with family members with the safety of the barrier of plexiglass. So there might be other solutions, creative solutions like that, where they just give people more of a chance to be visited while doing it in a safe way.
Okay, thank you, Erica. Chris Simon, do you have a question?
I do. The province said today that it has increased its testing capacity significantly over the last couple of weeks. But it doesn't sound like maybe that trickling down to the Simcoe Muskoka region. Is that a fair assessment?
To answer that question, I'd have to look at rates of testing in Simcoe Muskoka versus the province. I do know that we have, one of the things we look at is the percent positivity rate of our tests. Like of all the tests that are done, how many are positive? And having that as a low number is a good thing. It means you're doing a whole lot more testing than you're getting back negatives. That you're testing so much that the cases that are out there make up a small minority, and it's an indicator you're doing a lot of testing. So we have a low case positivity rate, as does the province, and it's been going down over time over the last couple of weeks, which I think would perhaps corroborate what has been claimed provincially about the adequacy of testing improving. I did note a difference between Simcoe versus Muskoka, but I think it would be to answer your question really well, we'd have to look a little bit deeper about how's our rate of testing versus the province as a whole, and I actually don't have that figure in front of me, so we'll look into that.
Okay. And the other question, I was just hoping you could touch on the fact that the province, when it issued its emergency orders, put a 30-day cap on refill prescriptions, and we've since had a number of seniors contact us to say that this is forcing them into the community more often when they're supposed to be staying home. Do you see a necessity in this 30-day cap?
My understanding is that was done in order to avoid a run on medications and hoarding and shortages, as has happened with certain retail items, and that there's no way that we could allow that to happen because it's such a critical resource. I don't know if we're now in the position where they could relax that or not. I could see the value of it if they could.
Thank you.
Thank you very much. Craig Longley from CTV, are you on the line? Okay, is there anyone else who has questions for Dr. Gardner or that I may have missed?
Sean Gibson from Barrie Today.
Hi, Sean.
No.
Hi. Just wondering, Dr. Gardner, are you surprised at the amount of outbreaks in the long-term care facilities that we have, knowing that we went into this with a huge amount of warnings?
Well, I'm...
And I was being into the Barrie area with 5.
Yeah, I am disappointed, alarmed. This is despite us managing to keep our per capita rate overall low. It's despite us having put in place universal mask use at all times while providing care in long-term care facilities, and despite the screening that's been happening about entrance of residents to these facilities, and also the daily screening for symptoms and temperature of staff and residents. So it is disappointing. We've actually been very fortunate till recently about having a very low number compared with the GTA, and it may be that we're delayed rather than truly spared. That our numbers in the community didn't come till later and have been lower, and perhaps for that reason it's been later coming for long-term care. We've certainly done what we can to prevent this. The further testing that the province has directed us to do may be a benefit to identify some asymptomatic cases and therefore be able to put further control into place. We shall see if that's helpful or not. Even once that's done, though, it's a one-time allotment of testing, and so it's of limited value. We have to continue with all the other control measures and the surveillance, because you can have things arise after you finish your testing. So I am concerned for sure, and I think we need to keep as vigilant as we can on it. It is certainly incumbent on us to do all that we can to control this to the very best of our ability.
Perfect. Thank you.
Thank you, Sean. Is there anyone else we may have missed? Okay, thank you. With that, we will see you all on Wednesday.
Bye.
Joel also embrace nature. I do all sorts of different things to kind of incorporate